Discover the health benefits and how to use the Kanuda Head Nap Traction Pillow, a cervical traction device ideal for relieving neck pain. The Kanuda Head Nap was designed to mimic physical therapy sessions at home by stimulating OCBR and CV4 techniques. OCBR is a manual technique to release muscle tension. CV4 is a well-known therapeutic procedure that works to ease anxiety and improve autoimmune dysfunctions. OCBR is known to reduce neck, shoulder, upper back, and head pain. It also corrects the curve of the cervical spine and forward head posture. This structural insert, located below the skull and neck dimple, is designed for OCBR therapy, helping soften the muscle tissue in the suboccipital area. It puts the body into traction while stretching shortened muscles. In addition, OCBR unblocks blockages, relieves pain, and alleviates muscle tension. The Head Nap CV4 therapy works to relieve tension, stress, and anxiety. Place your neck directly above the pillow. Align the position such that the OCBR grooves on the pillow are positioned directly underneath your knuckle line, putting the body into traction and stretching shortened muscles. Slightly tuck your chin in, and once again, bend your knees and stay relaxed. CV4 brings the body to a resting point in 10 to 30 minutes. Kanuda's Head Nap restores the flexibility of the autonomic system and helps improve autoimmune dysfunctions. Use the Kanuda Head Nap together with the Kanuda Lumbar Nap to relax the entire body and experience ultimate pain relief.